Picture this. A man is 68, retired mail carrier, still walks 2 miles most mornings before breakfast. His alarm goes off, and like every morning for 40 years, he's up and moving in under 10 seconds. No pause, no water, straight into the day. His doctor asked him one question at his last checkup. What's the very first thing you do when you wake up? He laughs. Get up, he says. That's the 6 words that started this whole conversation. Here's what I'll show you today. You wake up, you swing your feet to the floor, you're up and moving before your eyes have fully adjusted to the light. And most mornings, that feels completely normal. Nothing to think twice about. It's a reasonable way to feel. Most people over 60 have started their day this way for decades without a single problem. But here's something research has shown for years, and almost nobody explains it clearly. Heart attacks and strokes don't happen evenly across the day. They cluster heavily in the first few hours after waking. That's not a guess, it's a documented pattern. Picture someone in this situation, a composite of the kind of case that comes up often. A woman, early 70s, retired librarian, still hosts book club every week. Healthy, active, no obvious warning signs. Her mornings look almost identical to millions of other people's mornings. And that's exactly the point. This isn't about doing something rare or reckless. It's about 4 completely ordinary habits. I'm a health researcher. On this channel, I review published research on senior health and put it into plain English, the kind of explanation a 15-minute appointment rarely has time for. Before we go further, if any of this feels useful as we go, hit subscribe. I put one of these out every week. So let's talk about what's actually happening in your body in that first hour. Think of your cardiovascular system overnight like a quiet river. Slow current, low pressure, everything settled. The moment you wake up, that river gets a sudden rush of new water. Your blood pressure rises, your heart rate climbs, stress hormones, including cortisol and adrenaline, surge into your system. This is called the morning blood pressure surge, and it's completely normal. Everyone experiences it every single day. But here's the problem. A 2014 meta-analysis published in the journal Hypertension Research looked at morning blood pressure patterns across thousands of patients and found that people with an unusually steep, exaggerated version of this surge showed a meaningfully higher rate of cardiovascular events, independent of their average blood pressure the rest of the day. Read that again. 2 people can have the exact same blood pressure numbers overall and still face very different risk, depending on how sharply that number climbs in the first few minutes of being awake. That's the window we're talking about today, and 4 ordinary habits can make that natural surge harder on your system than it needs to be. I've ordered these from important to most overlooked. Number 3 is the one that surprises almost everyone. Number 4 is the one I see skipped more than any other, even though it may be the easiest fix on the whole list. Step 1, getting up too fast. When you go from lying flat to standing quickly, gravity pulls blood down into your legs, and your cardiovascular system needs a moment to adjust blood vessel tone to keep blood flowing to your brain. Doing that abruptly right on top of the morning surge asks your body to manage 2 adjustments at once instead of 1. This is part of why brief dizziness on standing, what doctors call orthostatic hypotension, becomes more common with age, and why it's tied to a higher risk of falls. The fix? Sit on the edge of the bed for 1 to 2 minutes before standing. Let your feet touch the floor. A few slow breaths. Give your system a head start. If this happens to you most mornings or feels severe, that's worth a specific conversation with your doctor, not something to just push through. Step 2, coffee before water. Caffeine activates your sympathetic nervous system, the same system already ramping up as part of the natural surge. Research has consistently shown caffeine produces a measurable rise in blood pressure and heart rate shortly after it's consumed. The fix isn't giving up coffee, it's timing. A full glass of water first, then 20 to 30 minutes before that first cup. 2 activators spaced apart instead of stacked on top of each other. If you're on blood pressure medication, that timing is genuinely worth asking your doctor about directly, since caffeine sensitivity can vary by medication. Step 3, and this is the one that surprises people. Extreme shower temperatures, very hot water widens blood vessels near the skin, which can drop blood pressure suddenly as you step out. Very cold water does close to the opposite, triggering rapid constriction and a stress hormone response. Either one layered on top of an already active surge asks your blood vessels for another sudden adjustment. The fix? Start lukewarm. If you love it hot or cold, save the extreme for a few minutes and once you've eased into it. Blood vessels naturally stiffen somewhat with age, a normal part of aging, which is exactly why this becomes more worth paying attention to at 65 than it was at 35. If you have a diagnosed heart condition or history of stroke, this is one worth asking your own doctor about specifically. Step 4, and almost nobody does this one, not drinking water at all. This one's different from the other 3. It's not about avoiding extra stress, it's about actively supporting your system during the hour it needs it most. Overnight, you lose fluid just through breathing and you go 7 or 8 hours without replacing any of it. That means your blood volume is already slightly reduced, right, as your body manages its biggest pressure shift of the day. The fix, a full glass of water, 8 to 12 Oz before anything else. Keep it on your nightstand the night before, so it's the first thing you see. If you take a diuretic, that's worth mentioning to your doctor since your fluid needs may be individual to your situation. If you have a parent, spouse, or friend this applies to, this is worth 60 seconds of their time. Send it to them. Now, the question I know is sitting in your head, is my morning routine really connected to my heart health or is this a stretch? Here's the honest answer. Cardiologists and researchers have studied morning cardiovascular risk for decades, precisely because the pattern is so consistent. This isn't a fringe idea. It's one of the more well-documented windows in cardiovascular research. Let me name where this comes from. The American Heart Association has published guidance on morning blood pressure monitoring. Hypertension Research has published multiple studies on the morning surge specifically, and the general pattern of cardiovascular events clustering after waking has been documented across decades of research referenced by groups like the National Institutes of Health. There are situations where you should call your doctor today, not next week. Sudden chest discomfort, sudden weakness on one side of your body, sudden vision changes, fainting on standing rather than brief lightheadedness. Any of those, call your doctor or emergency services right away. That's outside anything a video like this can evaluate. It needs direct medical attention. Let's through it quickly. Sit for a minute before standing, water before coffee, lukewarm before extreme temperatures, and a full glass of water as the very first thing you do. Here's the whole message in one sentence. Your body already knows how to handle the morning surge. These 4 habits just decide whether you're helping it or working against it. There's one more thing I haven't told you yet, and it's actually why next week's video on the 3 warning signs your blood pressure medication might need adjusting matters so much. If this helped you see your mornings differently, subscribe. I put one of these out every week. And in the comments, I genuinely like to know which of these 4 habits is already part of your routine. Take good care of yourselves. I'll see you next week. This video is for general educational and informational purposes only. It is not medical advice and does not create a doctor-patient relationship. Please always consult your own qualified healthcare provider for diagnosis and treatment. Illustrative scenarios in this video are composites. All identifying details have been changed to protect privacy. Any resemblance to a specific individual is unintentional. Portions of this video use AI-assisted voiceover and visuals.